The pandemic also putting pressure on healthcare providers. On Christmas morning, an employee at South Denver Nursing Home called 911 because she was the only one who showed up to work. CBS 4's Mike LaBeta has a follow-up to this story. He talked to the owner of the facility as well as a former nurse about staffing issues.
Engine 36, respond.
Christmas morning, an employee of Autumn Heights called 911 because they thought they would be the only nurse on shift for the entire living facility. They wanted COVID-positive patients to be transferred to the hospital.
I told her that that would overwhelm the system.
Jennifer Belden was a nurse at Autumn Heights for 8 months in 2021. She says things were bad when she left in November.
Little things started to catch my attention.
She says the facility was underpaying staff, overworking them, and wasn't hiring replacements when they quit.
They expected you to do too much, provide top quality care, but not pay you for what they wanted you to do.
We're in a crisis right now as an industry.
Jay Moskowitz is the owner of Autumn Heights. He admits they're understaffed, but it isn't for lack of trying. He says they're a Medicare facility, so they're capped at how much they can charge residents. That means they're limited at what they can pay employees. Because of that, staffing agencies are hiring his employees away with more pay. He's then forced to rely on those same agencies for staffing who pass the costs on to him.
She's going to come back and charge us 48% more than we paid last year.
He says another challenge they're facing is the Omicron variant, which has spread rapidly in his facilities, making both residents and staff sick.
Our staffing needs increased substantially and have not gotten better.
Jennifer says she doesn't think the patients at Autumn Heights are getting the care they deserve.
They're not going to get the quality of care that you're going to be charged for.
I'm Mike LaBeta, covering Colorado First.
The owner says he's in partnership with the state and will always make sure his residents are getting quality care.